Welcome to our great team of professionals. We're proud of our organization and all of our employees. Today we're going to provide some basic safety information so you may better understand your safety responsibilities and to help you become safer and healthier employees. You may not realize it, but you're the most important part of any safety program. Each individual must make hundreds of independent decisions on a daily basis that most always reflect somehow on the well-being of all employees. By using good judgment, each individual can make your work environment clean, efficient, and of course, safe and healthful. Regardless of your job, safety is an integral part of your responsibility, which means no matter the task you perform, safety must be a vital concern. Let's begin with some basics. The healthcare environment can be hazardous to your health if you neglect safety rules, policies, and procedures. The first step is to learn these policies and procedures, then apply them on a daily basis for each assigned task. We understand that your work is fast-paced. You're busy. There are many things to do. But if you maintain a safety attitude, you'll make the right decision when the time comes to perform all your jobs safely. In the healthcare industry, back injuries are the major type of injuries. You can prevent them by learning how your back works and by using your body correctly to maintain your back's 3 natural curves. Infection is a risk all healthcare providers share, but infection is also a risk to your coworkers and patients. Prevent the spread of infection by following infection control procedures and techniques, such as frequent washing of your hands, appropriate protective clothing where required, and avoiding needle sticks. Modern healthcare procedures help you take care of patients better and more safely, but these procedures often involve hazardous substances that are potential risk to you unless you know how to prevent exposure. The healthcare environment is a 24-hour-a-day business where routine tasks alternate with emergencies. The potential for accidents is everywhere. But if you have a good attitude and think safety first, you can prevent accidents from occurring. Certainly, this program cannot cover all possible potential hazards or safety rules. But let's take a few minutes to discuss some of the more important safety tips that can help you prevent accidents. We'll begin with safe lifting, since everyone is involved in lifting objects on a daily basis. Your back has 3 natural curves: the cervical curve, the thoracic curve, and lumbar curves. To maintain these natural curves and prevent back injuries, keep your muscles strong and flexible. Use good body mechanics to keep these 3 natural curves properly aligned. Distribute your body's weight evenly, particularly when lifting anything. When lifting, think about the object you're going to lift. If it's too heavy, get some assistance. Stand with your feet slightly apart. Bend your knees and not your waist. Lift with your legs and keep the load close to your body. When reaching, reach only as high as comfortable. Don't stretch. Use a stool or ladder if you need it. When reaching down, support your upper body with one arm if possible. When standing, help balance your spine by placing one foot on a low stool or other support. Keep your knees slightly bent, pelvis tilted forward. Avoid slouching, which can put a strain on your vertebrae. When pushing a load, stay close to the load. Don't lean forward, and use both arms to push. You can push twice as much as you can pull, so push rather than pull when possible. When sitting, sit in a chair that allows both feet to be flat on the floor. Maintain good posture because slouching puts pressure on the vertebrae. Use a lumbar support for your lower back. Most importantly, when you lift anything, think about your back and make the decision to lift correctly, regardless of the situation. There are probably thousands of different lifting situations, particularly awkward loads where you may not always be able to use the traditional bend your knees and lift with your legs type lift. In these cases, It's up to you to use the safest method of lifting and to prevent back injuries. As we indicated, infection control is everyone's business, regardless of your assigned department. You must know and understand your healthcare organization's policies and procedures and follow these rules specifically. Hand washing is 99% of infection control, so be sure to do a thorough job when you wash your hands. After washing and rinsing your hands and wrists, use a paper towel to dry your hands. Then use the paper towel to turn off the water. Remember that dirty hands were used to turn the water on. You'll become more familiar with infection control procedures, but remember that it's everyone's job, regardless of where you work. Another area of concern is electrical safety. Again, no matter where you work, electrical safety is an important part of your safety responsibilities. Don't place electrical cords where they may cause tripping hazards. Keep cords away from heat and water. When removing an electrical cord from a wall receptacle, pull the plug, not the cord. It's too easy to damage or break the cables inside the cord when you pull on the cord. Avoid kinking, crushing, or binding electrical cords. Inspect all electrical cords and plugs frequently for frays and cracks or broken insulation. Check the plugs to make sure they are also in good, safe condition. If your electrical equipment becomes defective, repair or replace it before using. If the equipment becomes excessively hot or starts to smoke or does not seem to work properly, unplug the equipment and have engineering inspect and repair it before using it. Naturally, if you receive any type of shock or electrical tingle when using electrical equipment, shut it off, unplug it, and have it checked out. A minor shock means something is wrong, and the equipment could be quite dangerous if you continue to use it in this condition. While we're talking about electrical safety, let's also discuss fire safety. A clean and organized work area is the first step in fire safety. Never let storage areas become fire hazards. Keep all areas clean, neat, and organized. Dispose of combustibles such as paper, cardboard, and other materials in proper disposal containers. In the event of a fire, follow your organization's immediate action procedures. But generally, the most important part of immediate action for the person discovering a fire is to activate the fire alarm. A small fire can quickly get out of hand, so you want as much help as early as possible. Try to confine the fire to the smallest area possible by shutting all doors and windows, if it's safe to do so. Life safety is paramount, so never try to extinguish a fire or anything else if there is a life-threatening situation. Get help. In patient rooms, the safety of patients is critical, so follow proper procedures in this case. Fire extinguishers are important in suppressing small fires, so if you're not sure how to use extinguishers, be sure to ask your supervisor for training. Again, the reminder here is to fight the fire only if it's safe to do so. Be sure to notify others to help, and if it's safe, direct firefighting personnel to the fire. Amid an emergency situation, directions and instructions can become confusing. So stay calm and think of the best way to react to a fire situation. Patient safety, your safety, and the safety of others are the most important parts of immediate action. As you're beginning to see, safety is everyone's responsibility. It takes a team effort, with everyone doing their part to reduce accidents and injuries and to make your environment as safe and healthful as possible. Quickly, let's review a few more tips to help you improve safety in the healthcare environment. Compressed gases constitute several hazards. Any gas cylinder with a broken valve head becomes a missile capable of penetrating walls, doors, and almost anything else that gets in its way. Specific gases may be toxic or flammable, adding another hazard. Cylinders that are heated may result in an explosion. All this tells you that compressed gas cylinders require special attention. Cylinders must be secured at all times so they cannot be tipped over or fall. This is accomplished by chains and other securing methods. Valve safety covers must remain on the cylinders when not in use or until pressure regulators are attached. Containers must be clearly marked with the name of the contents. Tanks with wired-on tags or color code only should not be used, as these tags or color codes can be mixed up or confused with the actual contents. Hand trucks or dollies must be used when moving cylinders, and of course, never roll or drag any compressed gas cylinder. The use of oil, grease, or lubricants on valves, regulators, or fittings is unsafe. Oxygen and other gases may react violently with oil, grease, or lubricants, so it's important to understand this particular rule. Never attempt to repair damaged cylinders or to force frozen cylinder valves. Without a doubt, one of the most important safety tips is the use, care, and disposal of needles. Needle sticks can be life-threatening, and you should immediately recognize this every time you handle, store, use, or dispose of needles. You'll receive more training on this, but care must always be exercised when using or disposing of needles. Even putting your hand into a trash container is extremely dangerous. Sharp glass, tin cans, or other objects may be just as dangerous as needles, so it's up to you to exercise good judgment and caution on every job. Needles must be disposed of in the proper containers. They should never be recapped after use. They should be properly disposed of in proper containers, not only for your safety, but for the safety of all employees and patients. Proper disposal methods must be followed without failure. The same thing holds true for contaminated or infectious waste materials. Know the proper procedures and follow them to the exact letter of the rule. Have we left anything out? Probably hundreds of items. But the important message of this program is to think safety. Every time you perform a job, think of how it can be performed safely. If you have a safety attitude, it becomes second nature, and it becomes a good habit. If you know and understand your healthcare environment's policies, procedures, and rules, and you apply them to your daily activities, you'll be an accident-free employee. It won't take any more time or effort, but it can make a tremendous impact on the safety and health of all employees, patients, and visitors. It's the only way to go. Thank you.